Hello, welcome to my channel. If you like Dale, like or subscribe. Today we are going to talk about Loxapine medicine, brand names, Loxitane, Adasuve. I will explain its mechanism of action, its uses, its warnings, side effects and its dosage. What is Loxapine? Loxapine is a medication used for the treatment and rapid control of mild to moderate agitation in adult patients with schizophrenia or bipolar disorder. Mechanism of action of Loxapine. High-affinity antagonism of D2 dopaminergic and 5-HT2A serotonergic receptors. Posology. Loxapine. Inhalation. In adults, recommended initial dose, 9.1 mg. If necessary, administer a second dose 2 hours after the first one. Do not administer more than 2 doses. If the first dose is not tolerated, administer 4.5 mg. Observe the patient during the first hour after each dose to detect possible signs and symptoms of bronchospasm. Side effects of Loxapine. Sedation/sleepiness, dizziness. Throat irritation. Dysgeusia, dry mouth. Fatigue. Contraindications of Loxapine. Hypersensitivity to Loxapine or amoxapine, acute respiratory signs/symptoms, asthma, COPD. Warnings and precautions with Loxapine. Glaucoma, with a tendency to urinary retention. Known history of seizures, extrapyramidal symptoms, with respiratory involvement, CNS depression from alcoholism or other centrally acting drugs. Family history of prolongation of the QT interval, and concomitant use with other drugs that prolong the QT interval. Risk of bronchospasm, monitor. Interrupt treatment if tardive dyskinesia appears and if signs or symptoms indicative of neuroleptic malignant syndrome develop. Not recommended in patients with known cardiovascular disease, no data. It is not indicated for the treatment of psychosis related to dementia. Caution in intoxicated or delirious patients. There are no studies on renal failure and/or liver failure without established efficacy and safety in children under 18 years or in people over 65. Pregnancy and Loxapine. It will only be used during pregnancy if the potential benefit justifies the possible risk to the fetus. Breastfeeding with Loxapine. The extent of Loxapine excretion or its metabolites in breast milk is unknown. However, Loxapine and its metabolites have been shown to be transported in the milk of lactating bitches. It is recommended that women do not breastfeed for a period of 48 hours after administration of Loxapine and discard the milk produced during that period. Effects on driving ability. Loxapine. Loxapine acts on the central nervous system and can produce drowsiness, dizziness, visual alterations and decrease of the reaction capacity. These effects as well as the disease itself make it advisable to be cautious when driving vehicles or operating dangerous machinery, especially while the particular sensitivity of each patient to the drug has not been established.